When you or a loved one receives a diagnosis of heart failure, it can feel like you've been handed a complex map without any directions. The medical terms can be confusing, and the path forward may seem uncertain. However, one of the most useful tools your doctor has to help guide you is something called the New York Heart Association, or NYHA, Functional Classification System. Think of this system not as a frightening label, but as a roadmap. It helps you and your medical team understand exactly how your heart condition is affecting your everyday life. It's a way to measure and talk about your symptoms in a clear, consistent manner. The NYHA classes are not a measurement of how damaged your heart is, but rather a reflection of how you feel during physical activity. This is an important distinction. Two people could have similar test results for their heart, but experience very different symptoms. One might be able to climb a flight of stairs with ease, while the other gets tired just walking to the mailbox. The NYHA system focuses on your personal experience. It helps your doctor tailor a treatment plan that is specific to you, your lifestyle, and your goals. Understanding where you are on this map is the first step toward navigating your health journey effectively. This system is broken down into 4 simple classes, from Class 1 to Class 4. Class I represents the mildest form, where you might have a heart condition but experience no limitations in your physical activity. As you move up to Class 4, the limitations become more severe, to the point where any physical activity can cause discomfort. This roadmap is dynamic. It can change. With the right treatments, lifestyle adjustments, and medical care, a person can often move to a lower, less symptomatic class. This provides a sense of hope and control, showing that your actions can make a real difference. In the sections that follow, we will walk through this roadmap together. We will explore what each NYHA class means in practical, real-world terms. We will also dive into what heart failure is, how it affects your body, and why you feel the symptoms you do. The goal is to demystify this condition, replacing fear with knowledge and uncertainty with empowerment. By understanding your body and the language your doctor uses, you can become a more active and confident partner in managing your own health every step of the way. Let's break down the NYHA classes so you can see where you might fit on this roadmap. Think of it as a scale of energy and comfort. Class 1 is for individuals who have a diagnosed heart disease but experience no symptoms or limitations during ordinary physical activity. You can walk, climb stairs, or do your usual chores without getting unusually tired, short of breath, or having chest pain. In essence, your heart condition is present, but it doesn't interfere with your daily life. You feel normal during your regular routines, and the diagnosis is more of a background fact than a daily reality. Class 2 represents a slight limitation of physical activity. People in this category feel comfortable when they are at rest. However, ordinary physical activity like a brisk walk, carrying a heavy bag of groceries, or climbing a couple of flights of stairs results in symptoms. You might feel fatigue, a racing heart, or shortness of breath. Daily life is manageable, but you start to notice that your body can't quite keep up the way it used to. You begin to unconsciously adapt, perhaps taking the elevator instead of the stairs. Moving to Class 3, we see a marked limitation in physical activity. Even less than ordinary activities now cause symptoms. Simple tasks like walking from one room to another, getting dressed in the morning, or making a small meal can bring on fatigue or shortness of breath. You still feel comfortable when you are completely at rest, but the threshold for triggering symptoms is much lower. Life becomes more restricted, and you might find yourself avoiding activities you once enjoyed because they have become too physically demanding. Your world can start to feel smaller as your energy diminishes. Finally, Class 4 is the most severe stage. In this class, you are unable to carry on any physical activity without discomfort. Symptoms of heart failure are present even when you are at rest. If you try to do any physical activity, the discomfort increases significantly. People in Class 4 often feel tired and short of breath even while sitting in a chair or lying in bed. This class represents a serious stage of the condition, where the focus of care is on managing symptoms and improving quality of life, often with very intensive medical support. Understanding these classes helps you communicate your experience clearly to your doctor. Now that we understand the NYHA classes, let's take a step back and talk about what heart failure actually is. The term itself can sound very alarming, as if the heart has completely stopped working. That's usually not the case. Heart failure, more accurately called congestive heart failure, means that the heart muscle isn't pumping blood as well as it should. Your heart is a powerful muscular pump responsible for sending oxygen-rich blood to every single part of your body. When this pump becomes less efficient, your body can't get the fuel and oxygen it needs to function properly. This weakening of the heart's pumping action can happen for many different reasons. For some people, it's the result of a heart attack that has damaged the heart muscle. For others, long-term conditions like high blood pressure are the culprit. Over years, high blood pressure forces the heart to work much harder to circulate blood, and just like any overworked muscle, it can eventually become tired and weak. Other causes include faulty heart valves that leak or don't open fully, diseases of the heart muscle itself, known as cardiomyopathy, or even some viral infections that attack the heart. There are two main ways the heart's pumping can be affected. The first is called systolic heart failure. In this case, the heart muscle becomes weak and can't squeeze with enough force to push a sufficient amount of blood out to the body. The heart's main pumping chambers, the ventricles, are less effective. You can think of it like trying to squeeze a water bottle that has become soft and flimsy. You just can't generate enough pressure. This is a problem with the heart's squeeze or contraction. The second type is known as diastolic heart failure. Here, the heart muscle can still squeeze properly, but it has become stiff and doesn't relax normally between beats. Because it can't relax fully, the chambers don't fill up with enough blood before the next pump. It's like trying to fill a water balloon that has become rigid. Not much water can get inside. So, even with a good squeeze, the heart is pumping out a smaller volume of blood simply because it didn't fill up enough to begin with. Both types lead to the same result. The body isn't getting the blood supply it needs. When the heart begins to struggle, your body doesn't just give up. It has a remarkable set of built-in emergency responses designed to compensate for the weakened pump. In the short term, these responses are incredibly helpful and can keep you going without you even noticing there's a problem. Your body is smart, and its primary goal is to make sure your vital organs, especially your brain and kidneys, continue to get enough blood to survive. It will do whatever it takes to maintain this critical supply line, pulling resources from other parts of the body if necessary. One of the first things your body does is activate the sympathetic nervous system, which you might know as the fight or flight response. This system releases hormones like adrenaline. These hormones make your heart beat faster and more forcefully, trying to squeeze out more blood with each pump. They also cause blood vessels in less essential areas, like your skin and digestive system, to narrow. This diverts blood away from those areas and sends it toward the brain and other core organs. It's a clever survival strategy, like closing off smaller roads to keep traffic flowing on the main highway. Another key response involves your kidneys. When your kidneys sense they aren't getting enough blood, they assume the body is dehydrated. In response, they release hormones that cause your body to hold on to salt and water. The idea is to increase the amount of fluid in your bloodstream, which in turn raises your blood pressure and hopefully improves blood flow. The body thinks, if there's more fluid in the pipes, the pressure will go up, and more will get to where it needs to go. This is a logical response to what the kidneys perceive as a low-volume problem. The heart itself also tries to adapt. Over time, to cope with the increased workload, the heart muscle can get bigger, a process called hypertrophy. Just like lifting weights makes your biceps grow, the heart muscle thickens to try to generate stronger contractions. The heart chambers might also stretch to hold more blood, hoping that a larger volume will result in more blood being pumped out with each beat. These are all intelligent, short-term fixes designed to keep the system running, despite the underlying weakness of the pump. For a while, they work. Perfect. While the body's initial responses are meant to be helpful, they actually become a major part of the problem over the long term. These coping mechanisms, which work so well in a temporary crisis, can cause significant damage when they stay active for months or even years. The very solutions the body uses to compensate for heart failure eventually start to make the heart failure worse. This creates a vicious cycle that's honestly really difficult to break without medical intervention. The helpful actions begin to have harmful, long-lasting consequences, turning what was supposed to be a short-term fix into a chronic problem. Let's look at the fight-or-flight response. While making the heartbeat faster and stronger seems like a good idea at first, a constantly racing heart puts a huge strain on an already weakened muscle. It's kind of like forcing a tired runner to sprint a marathon. Over time, This constant demand for more work just wears the heart out even further. The adrenaline that drives this response can also be toxic to heart muscle cells over the long run, causing even more damage. The narrowing of blood vessels also forces the heart to pump against higher pressure, which is, honestly, precisely the problem that may have contributed to the heart failure in the first place. The kidney's response of retaining salt and water also backfires. Initially, increasing fluid volume helps maintain blood pressure, but in a person with a weak heart, this extra fluid is just too much for the pump to handle. The circulatory system becomes overloaded. This excess fluid doesn't just stay in the blood vessels, it actually starts to leak out into the body's tissues. This is what leads to the congestion and congestive heart failure. The fluid can build up in the legs and abdomen, causing swelling, and most dangerously, it can fill the air sacs in the lungs, making it very difficult to breathe. The heart's own attempt to remodel itself by getting bigger also becomes problematic. A heart muscle that has become thick and stiff, what we call hypertrophy, doesn't relax well, leading to diastolic heart failure. A heart that has become stretched and enlarged or dilated becomes floppy and weak, worsening systolic heart failure. An enlarged heart also needs more oxygen to survive, but its own blood supply from the coronary arteries often can't keep up with the demand. This can lead to chest pain and further damage to the heart muscle, continuing the downward spiral of the condition. As the body's coping mechanisms start to cause problems, you will begin to feel symptoms. These symptoms are the body's way of telling you that the heart is struggling to meet its demands. One of the most common and earliest signs of heart failure is fatigue or feeling unusually tired. This isn't just the normal tiredness you feel after a long day. It's a persistent, draining exhaustion. This happens because your major muscles and organs are not getting enough oxygen-rich blood. Your body is essentially running on a low battery, so even simple activities can feel like a major effort. Another hallmark symptom is shortness of breath, which doctors call dyspnea. At first, you might only notice this during exertion, like when you're climbing stairs or rushing to catch a bus. This is because when you're active, your muscles need more oxygen, and your weak heart can't pump blood fast enough to the lungs to pick it up and deliver it. As heart failure progresses, you might feel breathless even with minimal activity. This is a direct result of that fluid buildup we discussed. When fluid backs up into the lungs, it fills the tiny air sacs, leaving less room for air. It's like trying to breathe through a wet sponge. This shortness of breath can be particularly noticeable at night. You might find you need to prop yourself up with 2 or 3 pillows to breathe comfortably, a condition called orthopnea. When you lie flat, fluid that had settled in your legs during the day, thanks to gravity, moves back into your bloodstream. This extra fluid overloads the heart and backs up into the lungs more easily. Some people even wake up suddenly in the middle of the night, gasping for air, in what's known as paroxysmal nocturnal dyspnea. They feel like they are suffocating and have to sit or stand up to catch their breath. Another very common sign is swelling or edema in the lower parts of your body. You might notice that your shoes feel tight, your socks leave deep indents in your ankles, or your legs look puffy. This is caused by the combination of fluid retention and the heart's weak pumping. The kidneys are holding on to extra salt and water, and the heart isn't strong enough to pump that fluid back up from the legs and feet efficiently. Gravity pulls the excess fluid down, causing it to pool in your ankles, legs, and sometimes even your abdomen. This can also cause rapid weight gain over just a few days. As heart failure progresses and moves into the higher NYHA classes, the symptoms can become more pronounced and new ones may appear. These signs often indicate that the body is under significant strain and that the heart's function is declining further. One such symptom is a persistent cough or wheezing. This isn't a cough from a cold, it's often a dry, hacking cough that can be worse when you are lying down. This is caused by the same fluid congestion in the lungs that causes shortness of breath. The fluid irritates the airways, triggering a cough reflex, much like how you might cough if you accidentally inhale a bit of water. A loss of appetite or feelings of nausea can also develop. This might seem unrelated to the heart, but it's directly connected. When the heart struggles to pump blood forward, blood can back up in the veins that lead from the digestive system. This can cause the liver and intestines to become swollen with fluid. This congestion in your abdomen can make you feel full, bloated, or even sick to your stomach. Eating a full meal can feel uncomfortable, which can lead to unintentional weight loss over time, even while your body is retaining fluid. This combination of fluid weight gain and muscle loss can be very confusing. You or your family might also notice changes in your thinking or alertness. This can be very frightening. Symptoms like confusion, memory loss, or disorientation can occur when the brain isn't receiving a steady supply of oxygen-rich blood. Additionally, changing levels of sodium and other substances in the blood, due to the effects of heart failure on the kidneys, can also affect brain function. A loved one might seem more forgetful or have trouble concentrating. This is a serious sign that requires immediate medical attention, as it indicates the heart failure is significantly impacting the entire body system. Another advanced sign is a very rapid or irregular heartbeat, which you might feel as palpitations or a fluttering in your chest. An overworked and enlarged heart is more prone to developing abnormal heart rhythms. The heart's electrical system can become unstable, causing the heart to beat too fast, too slow, or in a chaotic, irregular pattern. These arrhythmias can be dangerous because they can further reduce the heart's ability to pump blood effectively, and in some cases can increase the risk of stroke or sudden cardiac arrest. These more advanced symptoms are signals that the body systems are becoming overwhelmed. Understanding your condition is the first, most powerful step you can take, but you don't have to walk this path alone. Managing heart failure is a team effort, a partnership between you, your family, and your healthcare team. Your role on this team is crucial. You are the expert on your own body. You are the one who knows how you feel from day to day. By learning to monitor your symptoms, you can provide your doctor with the vital information they need to adjust your treatment plan. This active participation can make a world of difference in your health and quality of life. A key part of this partnership is daily self-monitoring. Your doctor will likely ask you to keep track of a few simple things. One of the most important is your daily weight. Weighing yourself at the same time every morning after using the restroom but before eating can be the earliest indicator of fluid retention. A sudden weight gain of 2 to 3 pounds in one day or 5 pounds in a week is a red flag. It tells you that your body is holding on to extra fluid, and it's a signal to call your doctor's office, often before you even start to feel more short of breath. Following your treatment plan is another cornerstone of managing heart failure. This includes taking your medications exactly as prescribed, even when you start to feel better. These medications are designed to help your heart work more efficiently, reduce strain, and get rid of excess fluid. Your plan will also likely include dietary changes, especially reducing your salt intake. Salt makes your body hold on to water, which is something you need to avoid. Limiting processed foods, canned soups, and fast food can have a huge impact. Light physical activity, as approved by your doctor, is also important for keeping your body as strong as possible. Finally, open and honest communication with your medical team is essential. Don't be afraid to ask questions. If you don't understand a medication or a recommendation, ask for clarification. If you are experiencing a new symptom or a side effect, speak up. Your doctors and nurses are there to help you. By using the language of the NYHA classes, you can explain exactly how your symptoms are affecting your life. Saying, "I feel like I'm in class 3 now because I get breathless just walking to the kitchen," is much more specific and helpful than just saying, "I feel worse." This makes you an empowered, effective partner in your own care. The diagnosis of heart failure can feel overwhelming, but it is not a final chapter. It is the beginning of a new journey, one that can be navigated with hope and confidence. Knowledge is your most powerful tool. By understanding what heart failure is, how it affects your body, and what the NYHA classes mean for your daily life, you strip the condition of its mystery and fear. You transform from a passive patient into an active participant, capable of making informed decisions and working alongside your healthcare team to achieve the best possible outcome. Remember that the NYHA classification is not a permanent label. It is a snapshot in time, a way to measure how you are feeling right now. Many people, through diligent adherence to their treatment plans, medication, diet, and lifestyle changes, are able to improve their symptoms and move to a lower, more functional class. This progress is a testament to the resilience of the human body and the effectiveness of modern medicine. Your journey with heart failure will have its ups and downs, but improvement is always the goal and is often achievable. For families and caregivers, your role is one of profound importance. Your support, encouragement, and watchful eye are invaluable. By understanding the signs of worsening heart failure, such as sudden weight gain or increased shortness of breath, you can help your loved one recognize when it's time to seek medical advice. You are a vital part of the care team, providing emotional strength and practical help that can make managing a chronic illness feel less like a burden and more like a shared challenge. Your partnership is a source of immense strength. Ultimately, living with heart failure is about focusing on what you can do, not what you can't. It is about celebrating the good days, learning from the challenging ones, and moving forward with a plan. By embracing knowledge, committing to self-care, and building a strong partnership with your medical providers and loved ones, you can continue to lead a meaningful and fulfilling life. Your heart may have its challenges, but with the right map and the right team, you can navigate the road ahead with purpose and hope.